Hi all, welcome to Dentistry Worldwide with Dr. Saurabh Malhotra. Today we are going to discuss a case that has come to the clinic. A 12-year-old male patient came to the clinic with a chief complaint of bluish grey discoloration on the lower front tooth since childhood. So with this patient, we did ask about medical history and systemic illness. Nothing was reported by the parent, and we also asked about the detailed family history. And the parent told that the young sibling, he also has this kind of teeth, and the mother also has the same color of teeth. So you can see here the lower anteriors, they are giving a bluish gray opalescent hue on this labial surface. You can also call them translucent or amber color. So here you can see the chipping of the enamel. See, the enamel is chipped off from here on the incisal surface of this anterior teeth. You can see the chipped enamel and this dentin portion. Bleeding or probing was also noted for this patient while doing examination. As you can see here, let me read it for you. As you can see, there is inflammation on this marginal gingival area. So with respect to upper interiors, you can see here this is white spots that are present on the upper central incisors and lateral incisors as well. You can note this chipping of the enamel surface from the incisal edges of 1-1 and 2-1 as well, and also from this lateral incisors also you can see this chipping of the enamel surface with respect to upper interior. So with respect to IOP of this patient of the lower anterior teeth, you can see this is loss of enamel structure from this incisal third of the tooth surface. And you can also find the open contacts for this patient because of the loss of enamel structure. Coming to the root portion of this tooth, you can see the thinner pulpar canals which are thinner than usual, and this is what you called as thread-like appearance. Coming to the cervical portions of this tooth, it is the constriction. You can see here the constriction on the cervical portion of the tooth surface, which gives this tooth or this condition a bulbous appearance. Further OPG was done for this patient, and the OPG revealed a bit dense trabecular pattern of bone with respect to mandible area. You can see the bone looks much denser than the usual. Then coming to the tooth portion of this OPG, all the teeth, especially the premolars and molars, they have these bulbous crowns. You can see all of them, the premolars and the molars, they have these bulbous crowns. Bulbous crowns means they have a bigger crown with constriction of the cervical portion. Means they are narrow from the cervical region, and they are much broader than the middle and incisal third or occlusal third region of the tooth. So based on the clinical and radiographical findings, diagnosis of Dentinogenesis Imperfecta, that is type 2 of Shields classification, was given for this patient, and patient was told about the treatment plan, and we have started the treatment for this patient. Oral prophylaxis was done for this patient as of now, and we will plan the lithium disilicate glass ceramic crowns for this patient. Now I want to talk a bit about Dentinogenesis Imperfecta, as it is also known as hereditary opalescent dentin, or it is also called as Capdi-Pont dysplasia. You should know that this is a localized mesodermal dysplasia which affects both primary and permanent dentition. But most importantly, it occurs as inherited autosomal dominant pattern. So this is an autosomal dominant disorder that happens in primary or permanent dentition. It is because there is dentin hypertrophy and constriction of the roots. That's the reason why there is a partial or complete obliteration of the pulp, canals and chamber with respect to anteriors mostly. If any of you want to know what is the difference between autosomal dominant and recessive disorders, please let me know in the comment section, or you can DM me also in my Insta page, or you can message me here also. So talking about the types of Dentinogenesis Imperfecta, it has three types. The type 1 is associated with osteogenesis imperfecta, The type 2, there is no association with osteogenesis imperfecta, and the type 3 is it mostly occurs in the brandywine triracial populations. So this is the case report that I had to discuss today. The patient is still going on, and we are doing the treatment for this patient. Once the treatment gets complete, we will surely make a video and put it on our YouTube channel. Till then, please subscribe to my channel and please watch the videos. If you like, please like the button and please keep supporting. Thank you. Thanks a lot.